Okay, so why don't we get started? Leah will hopefully be joining us in just a moment. Thank you for joining us tonight. And so I see Kathy has joined us. Hi, Kathy.
Hello.
We have Kate, we have Rainey, and we have Francine here. Thank you for joining us. I'd like to open the meeting at 5:02. Let's see if anybody has any comments during open time for the public.
Hi there. I just wanted to mention something that's not in the agenda, if that's okay, Kate.
Yes.
Hang on, I've just been rushing around all day. Let me just start my video so I can say hi. Hi. I just wanted to, I know we're going to talk about the vaccine clinic, but I just wanted to let you and Jerry know, and I think you might both already know this, that the Council on Aging is having two UMass nursing students working in conjunction with them this semester. And I'm actually the clinical faculty that's going to be overseeing their experience. And we had an initial meeting with the police chief. The fire chief wasn't there, and a few other people. And it was out of concern for some elders in the community. There was at least 2 or 3 incidents where people with dementia or other cognitive disabilities were not able to access help in a timely manner. And so the students are going to be doing a variety of things, from helping to get more people onto the code red, spread the word about the lock boxes, doing some outreach. So I just wanted mostly for you and Jerry to know that, and to ask if you have suggestions. And there is a follow-up meeting that's going to involve our 2 chiefs, and I think Ed Gibson, myself, and I wanted to invite both of you to come. I think someone from Triad is going to be there also. I'm not sure. They had a conflict, so they're going to send one person. Anyway, it's just a follow-up meeting to see, what can the students do? We have, their energy and enthusiasm. They're second bachelor nursing students. And so they're going to be writing an article for the newsletter. And so we just want to put our heads together and see if there's anything that we can do to help seniors, particularly people that are, have a disability, to be more safe. The meeting is February 9th at 1:00 in the select board meeting room, unless, of course, we're going to be, in another lockdown situation. But as of right now, it's just tentatively that particular date. So if you're able to come, anybody can come for that matter, but we're just trying to have enough room to space out, but also get the right people there that could have some good suggestions for the students.
Okay. And I just want to add just to that very quickly, the Friends of the Council on Aging are meeting on Tuesday. This is the first meeting we're having. And on our agenda is, their thoughts on what the needs might be, so that we could have some input into this as well, coming from their perspective.
Great.
So I'll gather that on Tuesday and I'll get it to you.
I do have a meeting conflict on the 9th, but I am seeing if I can change it so I can attend that meeting.
Yeah, that'd be great. Just because of your experience with, people with dementia and such, that would be really helpful. So yeah, let me know. And if anybody has any suggestions.
A time on that?
The meeting is February 9th. When the students have their clinical on Wednesday, so it'll be Wednesdays that they'll be at the center. There are 2 of them, and the meeting is at 1:00 on the 9th.
Thank you.
Mm-hmm. Okay, thank you.
I'll probably set up a Zoom link too, in case anybody would like to join but won't be able to go. And I'll make sure that that's on the website.
Perfect.
All right, thank you.
Thank you for all your coordinated efforts on that. It sounds like it's really important right now to be focusing on that, especially with everything that had happened. So I appreciate you also bringing students in. I think it's a great learning opportunity. All right, do we have any other comments and open time for the public? Okay, great. So we'll move right along to approving the minutes from January 10th, where we reviewed the distribution of test kits, which we're also going to discuss further tonight, since there are more test kits allocated and there's been some additional information about the federal government providing some test kits, but not everybody is eligible to receive them, which is a little bit frustrating for certain populations. I learned from Ed today that he did receive a part of the allocation of the 700 test kits, which is great. So we can start distributing those. Nicole reviewed that she had finalized the barn book, which is excellent. Francine brought up about the concern of keeping the Council on Aging open, which we think we also need to review tonight. And the Council on Aging is currently remote for 4 weeks through February 12th. We discussed the vaccine clinic and adequate coverage to make sure that happened. And the vaccine clinic, first one went extremely well. Of course, the second one is being rescheduled. We'll talk about that as well. Does anyone have any comments about the minutes?
No, I thought they looked good. Very thorough.
Okay, great. So can I have a motion to approve the minutes from January 10th?
I'll motion to approve the meeting minutes from January 10th.
Seconded, Carrasquillo.
Okay, awesome. Thank you. Okay. Thank you for that. And I guess we'll just have to catch up on a signature next time.
No, actually, you signed it, and if they just authorize you to sign it, it's
Okay,
fine.
perfect. Sorry, that one's got notes all over it, so. Okay, so I'd love to just give a couple quick updates about the vaccine clinic. So at the first clinic, which everybody worked together really well, Northampton Vaccine Coalition was incredibly helpful and responsive to helping us add in more vaccine appointments as they were needed. We were able to vaccinate over 200 people at that clinic, and we were hoping to have the second clinic on Saturday, but because of the impending snowstorm, it's being rescheduled for February 5th. That has been posted on both Southampton community forums and in the Norris School Group. And I did make sure that people are notified that the registration for this clinic remains open, so people are still able to sign up, and maybe we'll be able to get a few more in attendance at the clinic on February 5th. I just wanted to say also thank you to Rainey for signing up as a vaccinator. That's excellent. We had a lot of good feedback from town citizens in Southampton about how helpful it was to have a clinic very locally. And it was really nice to see many kids who go to Norris School having access to vaccine right at Norris School. So any questions or comments about the upcoming vaccine clinic?
I also wanted to comment that I looked at my schedule and I am available that day. So if there's any additional need for another vaccinator, I'm happy to dedicate my time.
Will you reach out? Okay.
I'll reach out to Lauren and let her know.
Okay. Sounds great.
Awesome. Thank you. Okay, moving right along to health director updates.
I checked today with our contact tracer to see what we have for confirmed cases, and the cases are dropping. We're down to 36, which is really, really good. Of course, that's the PCR testing that gets reported. There will be some people that are doing, the take-home tests, but basically the numbers really are coming down. And DPH said that right now they're looking to make different decisions about surveillance moving forward. They said that for many high volume diseases like influenza, surveillance systems don't try to capture every case. They focus on severe outcomes, prevention measures, and protecting the vulnerable populations. So I think that's where we're going to be heading in the future. They'll still be keeping an eye on the emergence of new variants. And this won't happen overnight. We're going to have to educate our elected officials and the general public as these decisions are made going forward. I think we may see just a small uptick after February vacation because people are going to be traveling. A lot of people are taking vacations, and maybe semester break with the college kids. I think basically things are going to calm down a little bit. Yes, knock on wood. Fingers crossed. So, and then the other item, I had met with the Hampden Ponds Association folks. because they had an interest in having, sort of resurrecting the sewer project that was started in 1998. And I facilitated the meetings with Randall and Ed Gibson also, and the Time Bond engineers. Actually, Bill Hardy, who's at Time Bond now, was the original project manager with SEA. He's been very informative. And he has, I believe I sent you a copy of the proposal to review that original design that was done. We spent about $350,000, $400,000 on it back in the day, and then never implemented the project. So I sent that proposal out to all of you and to Ed to distribute to the select board members. The Hampton Ponds folks, some of them will be at the select board meeting on Tuesday night. They'd like to speak to the select board. And then Ed's going to reach out to the Time Bond engineers so that they can meet with the select board. I think the 15th of February, he's planning on it. It's an opportune time to take a look at this. You know, we could use some of the ARPA money. It's a small amount of money. It's about $12,000, I guess, for them to go through and do all of the review. And then there's federal money, infrastructure money that will be available. So they're pretty excited about it. And the Westfield treatment plant has capacity for Southampton. So they'd probably be glad to get the, the customers moving forward. And I think that's about all I have for right now. I've been busy trying to get the clinic rescheduled and get everybody organized. So if I think of anything else, I'll let you know. We did have some cranky people, and it's not just this office. Northampton has had emails, East Hampton. I think people are just getting really tired of COVID, tired of masks, and we understand that it's difficult. But, spring is around the corner.
Surprisingly, right?
I hope, after the storm.
Any other updates?
I don't know about Nicole. She was going to try and get on the meeting, but she may have had an issue at the farm. So she's still working, doing Title V inspections, and things are just moving forward. I'm trying to get all of the letters out for renewals for all the permits, trash haulers, inspectors, et cetera, et cetera. So it's pretty busy around here.
Okay.
You've got a few things, Kate.
I do have a couple of updates and things that I'd like to discuss. One of which is I went to the school committee meeting earlier this week because the school is looking to shift their testing protocols. So Norris, by direction of DESE, is going to eliminate test and stay as a strategy to test people every day after a COVID exposure to keep them in school. They're going to be replacing this program by providing students and faculty with a once-a-week take-home test, which of course still has its gaps because it doesn't necessarily allow for a robust test and stay type strategy where you're testing kids repeatedly to make sure that they're safe in school. It does not allow for extra tests if someone is to develop symptoms. It also does not address the needs for like extracurricular activities, things like that. It's really school focused. I spoke to Stephanie about this new protocol, and it's in addition to, and I learned this, it's in addition to the pooled testing. So schools will still be required to test all students once a week. That testing, I believe, is done on Tuesdays. Yes. So of course, one thing that I talked about with Stephanie is the challenge is if you test on Tuesday, there's no saying that that person can develop symptoms or become contagious in between Wednesday and Monday, right? So this testing every week, and it is an opt-in program, so not everybody participates in the testing, but she says hopefully with the 2 swabs where they can quickly identify a positive pool and then retest all the swabs in that specimen. Hopefully that will allow for more timely identification of positive cases in school. Everybody is really supportive of implementing this take-home rapid test strategy. I think it just allows for more testing. Francine actually shared this really great article that was parents approaching the state in terms of additional protection strategies and strategies to help make schools safer. And one thing that I noted in there was that they really don't feel like the once a week pooled testing is sufficient. It'd be great if it was twice a week because it does really only capture a certain period of time. And many students are developing symptoms for whatever reason. It could be COVID, could be other reasons, but it still is keeping children out of school. So hopefully having this testing will at least allow for students to get back to school more quickly once their symptoms resolve, especially because of the challenges with finding PCR testing. Ed mentioned today that we have received a part of the first 700 test kits that we discussed at length on how to appropriately distribute. And in between our last meeting and this meeting, a few things have changed, right? They are providing test kits to school students. We know that 8 tests are reimbursable through private insurance, but this doesn't capture state or federally funded insurance programs. So a huge part of the population that's our most vulnerable folks are people who are eligible for Medicare. And some of these folks who might be low income might not be able to afford tests. And I think that's a really valid point. I think it's unfortunate that they're not able to be reimbursed for rapid tests.
Medicaid also, Kate, does not reimburse. Is that correct? Medicaid and Medicaid.
And Medicaid.
Okay, so Mass Health won't reimburse.
So any state and federally funded insurance program is you'd think that they would be really included in this plan for test distribution. So I was thinking that we are going to have another 700 test kits, and it would be a good idea for us to discuss and potentially weigh in on the best way to distribute those tests, taking into consideration the things that have changed from last meeting to now, right? The good thing is that everybody is able to order 4 test kits from the federal government. I ordered mine the first day that they were posted, and I've already received mine, which is good news. Any family can go to covidtest.org and they will be shipped 4 tests to an address. So if you can't order multiple test kits, more than 4 tests per household at this point. I think that will be reevaluated, but at least that gets 4 tests to each household. The other issue with that came up is apartment buildings. Some people were having trouble ordering for multiple apartments in the same building because there was the same address. So I'm hoping that they're working through some of that. It's really frustrating.
At this point, Kate, was that just a one-time thing? Were they saying just like we give the 4 per address, like once? There's no plan to have it be like again in a month or any timetable?
I think right now it's only.
Not yet.
One time.
Yeah.
Okay.
So give it 3 weeks and that might change.
And is it the
again.
same for insurance distribution? Do you know, is it like 8 tests per month or?
Per person per month. So
Per
a
person per
household
month,
of
okay.
3 would be eligible for having 24 tests reimbursed per
Okay.
month, which is excellent, except for the people that don't have private insurance, right? People who aren't working or people who are Medicare, Medicaid eligible. What was the other thing about testing? It was all so we've received some of the test kits, which we allocated all except for 146 of the tests. We kind of left those open. So there's about 846 test kits, which is 2 tests per kit that we have remaining that I'd like to brainstorm about how we can try to distribute them as fairly as possible, which of course is challenging because there's 3,500 households in Southampton. And I know we kind of touched on this during our last meeting, saying that it's really hard to fairly distribute such a limited number to the general population. But I think knowing that there's certain populations that might have a harder time getting access to tests or having testing reimbursed, that we can take that into consideration. What are other people's thoughts?
I mean, I completely agree. I think as far as Medicare, we know that anybody above 65 is eligible for Medicare. So maybe that would be an easy way to look at demographics and figure out based off of households who would be eligible in that group of individuals. Medicaid might obviously be a little bit more challenging. I mean, we could
Wonder if we went with the low income housing again and the food pantry and those ideas that we had that were maybe reaching folks who are more low income that way.
But I also think, we haven't even received the entire quantity of the first batch. So it's hard to also say, what is the use of those tests?
Right.
Like the school said that they would give us feedback about how many of those tests that they're using. So that way we'd have an idea of if it's sufficient, but we haven't even been able to get to that point yet. We did allocate 100 test kits to the Council on Aging, but obviously they haven't been distributed yet. So
in regards to the tests that were allocated for the school, I know you said that each student is going home with one test a week moving forward with the testing strategy. Is that using the test that we allocated to them? Is this a separate pool of
separate pool?
Okay.
So as far as I know, what they've mentioned in the meeting is that it's going to alternate weeks. So 1 week the test will go home with families with the kids, and then the next week the testing will go home with faculty. But they're hoping at some point that they'll be able to get their allocation kind of in a batch once every 2 weeks.
And my understanding was the pool testing was going to be done every Tuesday, and the at-home test kit testing was going to be done Thursday or Friday.
Right.
So, to kind of cover as best they can cover the week.
Right.
Kate, I just have a question. The students start next Wednesday. I mean, I was going to ask Jerry this because I don't know, one of the things I was hoping they can do is gain access to the folks that live in that apartment, subsidized apartments, 41 apartments. And so even though, as nursing students, I'm not asking for them to do runner work, like distribute test kits to all the residents there. If we had a handout on the lockbox program and we said, while I'm here, are you on code red? I mean, I don't know what you think about that, but if they can play a role, they start Wednesday. I have students in 5 different places, so I won't be there Wednesday, but I can certainly through Joan or others set up for them to do something if you're looking for pretty, quick distribution.
I can talk to the executive vice president because she's been there. They had as you know, a pipe break. And so they've had a lot of renovations going on. I just went over and did an inspection yesterday or Tuesday. So that's a great idea. I mean, if once they've got their common area, the common room, I think they were putting the new carpeting in there. We could have some of the residents meet with the nurses, your students. That would be perfect. And I'm glad to set that up for you.
Yeah, that would be wonderful. They are arriving, they're mostly 9 to 3, although they're doing a post-conference with me from like 3 to 4. Then they're jumping on the first hour of the COA meeting. But they're going to do a variety of things. And if they could have access, and if access could be to help distribute, if you're trying to do it within a week's time, I mean, they have a couple hours.
What we were thinking was to take the tests over. They have somebody in the office there, and then any of the residents can go down and request the test.
Right. Yeah, whatever you think. But they're available as early as next Wednesday. If there's any strategy that you can think of for, rapid distribution, they can be very helpful.
Well, I was going to take those 50 test kits that we've got for Southampton Meadows right over there so that they would have them immediately on Monday.
Okay. All right. Well, yeah, maybe I'll just check in with you before Wednesday and see what you think in terms of how they can be helpful. Okay.
Yeah,
Perfect.
give me a call and we'll talk, and then I
Okay.
can set something up so they can meet all the residents. I think that's
Okay.
important.
That would be perfect. They can do a little bit of outreach. We can get some information out. Ed moved the Code Red sign up onto the homepage instead of buried a little bit. And then the lockbox stuff is on the most recent newsletter from the COA. So if we can share that information with residents, make sure, I mean, nobody's kind of updated Code Red or provided some outreach to people about getting on that emergency response.
And some of them probably have cell phones, so they could get some help to get it on their
Right.
cell phones, so they get those messages right away.
Right. I know when they detonated the grenade over at the transfer station, a lot of the kids that are my kids' age in their 30s, I mean, they don't even know what Code Red is. So I mentioned it to someone who lives up by the transfer station and she wasn't aware of it. So I think there's a lot of work to be done, not just for seniors, but for the general public about getting on the emergency response calls or emails.
Definitely.
Yeah, give me a call, Rini, and we'll
All right.
set something up.
Okay, great. Thanks.
Thank you.
Can I just add something, Rini, to your list of items that maybe the nursing students might be discussing with the residents? Find out whether or not they've gone online or by phone, ordered the 4 free kits. And
That's
if
a
they
great point.
haven't, if we can collect that information, maybe through the COA or the Friends, we can go online and order them on their behalf.
Yeah,
That's excellent.
absolutely. The other thing I was thinking is now that we're moving the clinic to the following Saturday, what will be the window where the shut off will be for when people can sign up? Because if they have access to this group, they can certainly ask, are you vaccinated? Are you in line to get a booster? Oh, by the way, we're having them right around the corner from where you live. Do you know when the cutoff will be for, you have to sign up by a particular time?
Last time we ran out of appointment slots, but I think people were able to register up until like 2 days before. So
Okay.
I
So
can
maybe
check
we
in with
can-
Lauren. I'll ask Lauren about that to see if it's possible to leave open that registration at least through Thursday.
Okay, great. And then we can add that to the list of maybe if they're touching base with the residents there, they can ask them test kits, all of the above. That'd be great.
That's a great idea. Thank you for sharing.
Maureen, when you were talking about getting the word out to the younger demographic, the Norris School has a pretty good newsletter that reaches a lot of people and their website. Same for the high school. That might be a good place to distribute the Code Red information.
Yeah, that's a great idea. I think what I'll do is, I think a few people, when they found out that they weren't on Code Red, they were told to call Ed. I don't think that's a good strategy. I don't think we need to burden him with that. But I think the nursing students, I think they're going to be meeting with the fire chief, who's our EMD, is going to be at the meeting also when we strategize on updating as much as we can, the Code Red. But that's a great idea. I'll maybe ask them to contact the schools and put a little blurb in the newsletter, letting people know that it's right on the homepage of the website.
Now, when people are signing up for Code Red, do they just have to fill out like an online website in order to do that?
Yeah, if you go on the main page and you click on the link, it'll bring you to the Code Red sign up. And it's actually pretty simple, but knowing how much trouble it was to get on vaccine appointments, I think there's a number of people who could use some help. So all you have to do is put in whether you want a note, if you want to be notified by email or text or phone call on the Code Red. My concern was like, what about all these people that dropped their landline? What if someone died? Like, how do they fall off? I mean, can we get a administrative list of who is on the Code Red? And I was told by Ed that we can't, that we don't have access to that, and that it's based on the white pages. So if somebody gave up their phone line, then they would normally just fall off. But I guess we don't have any way of having a administrative whole list.
Could we set up a display when people come to vote? That would get quite a bit of the town.
Yeah, that's another good idea.
If it were a
Maybe that's another
laptop
thing
or
that they
something and they
can-
could sign up right there on the laptop.
Yeah, the students are here until the first week in May. But yeah, that would be another thing that they might be able to work on, is getting the materials together, a handout, that sort of thing.
Yeah, if there was a laptop, people could sign up right there when they're voting or when they arrive for a town meeting.
Uh-huh.
If you really wanted to push it, you could try for sporting events.
Yeah, that's great. We have no way of knowing, unless, Jerry, you know, how do we measure how many additional people have signed up? How do we know how accurate the list is? I think it's just a service we pay, I think $4,000 or $5,000 a year for that. I don't know if we have any administrative ability, or if anybody, I think it's all either confidential or something, but.
I believe it's confidential, and we don't get any of that information.
Yeah. Yeah.
I think those are great questions, and maybe we can brainstorm through some of those issues at that meeting on the 9th. Just have a place to.
Yeah, that's what I was hoping, that everybody would chime in and give the students plenty of things to do week to week.
That's great. And I'll certainly think about it after this meeting. And if anything comes to mind, I'll definitely be in touch with you.
Great. Thanks a lot.
Thank you.
To keep it updated, you might have to compare it to the town census for whoever has access to that. That would be a way to keep it current. And even when the town mails out censuses or tax bills, again, they could put a little flyer in there, anything to be reaching people.
I was thinking about a mailing or something, but yeah, that's a good suggestion.
Because then it's in a mailing that's already happening. It's not an additional expense.
Exactly. Good ideas. I appreciate the idea sharing here. Thank you. So just to go back to the discussion about how we can try to reach as many vulnerable people as possible who might have trouble accessing test kits, and with a focus on people who might not be able to get test reimbursed, right? So I've had feedback from a few people that Medicare people are not eligible. I don't know if anybody has any specific ideas about, I know that the Council on Aging does service a lot of our elderly folks, but not everybody. Not everybody goes to the Council on Aging.
Right.
And right now the Council on Aging is closed to in-person activities through February 12th, I believe. So it might be a little bit challenging to work on a distribution plan. Didn't know if anyone else had any ideas.
Well, I'm thinking too, it's people have Medicare and Medicaid cards. So if they wanted these, and that's the population you want to address, maybe they could just come into the Board of Health office to show the ID, and they get their cards and they're good to go. We don't have to have anybody's name or anything else.
Up to a certain amount of tests.
It would just be hard for people that are homebound, I guess, or who
Well,
don't
that's
go. I don't know. Is there like Meals on Wheels in Southampton? Is that someone we could partner with?
No.
I mean, I do like that idea, Jerry. I mean, because it's not so much of a free for all. There's a smaller population. We could,
Well, you're targeting the vulnerable population,
Exactly.
right? And that's who you want to have the tests. And
yeah.
we don't have to keep, as long as they have their insurance cards. If they've got them, they get the test and they're happy.
I do think the challenge there is going to be, we have a 20% population in Southampton, which is over 65. So, that's it is a lot of people, right? So we might not be able to capture everybody. And I think we might have to think about limiting it to a household, right? So if you have two households, so these test kits come with 2 tests each kit, right? So if a spouse, husband and wife come in, do we give them 2 kits or do we give them 4 kits, right? Do we give them a kit or do we give them 2 kits? And I think,
yeah, but the thing is, sometimes you have to wait and test yourself a few days later.
well, each of them come with 2. So then,
So you test first, and then a few days later, you might test the second time.
Would you want to start with 1 per household, just so that you would have some, in reserve? One kit, 1 2-pack.
I would maybe say 1 per person, because if you
Would we
think
have
about,
enough though with the population of people that are over 65 and including, we don't know how many people are in Medicaid, but you have to allot some for that.
yeah.
All right, so let's say,
I don't know. It's tough. It's tough because I get like Jerry's point of saying like, oh, you might have to retest, but then
Right.
what is the number of people and how many are we actually going to capture? And it's hard to predict.
And in theory,
And
those
what-
people are also going to be able to get each household can get 4 tests from the government. So it's not like this is the only way to access free tests.
correct. So if there's a 19.5% of the population who's over 65, that itself would be 1,170 people, right? So,
Yeah,
it's really, small numbers are hard to
but
make
that's
it
just
fair.
over 65. That's not everybody that might. you
Right,
know.
well, I'm just thinking about how could we broadly say,
Right.
anybody who,
Yeah, why don't you say 1 per household for now? And then if we find that we're just not getting a lot of outreach, we can readdress in a short period.
okay, and then that would be distributed here at the Board of Health
Sure.
office,
I'm glad to do it.
up to how many kids? That's the tricky part, right? So we have the 700 that were just ordered, right? Then we have the 146 test kits that we kind of left up in the air because we didn't know what the best option was. So that's really like 850. That's a lot. You know, it's a good start. So maybe we could do half of them and just say we're going to distribute them until they're gone.
Okay.
What do you think about that? Like we could do 400 or 500 test kits.
Yeah, I think that's a reasonable number.
So you want to do that to just those over 65 first?
I think
You want to
that's-
include it, what you originally said, Jerry, anyone who has Medicare or
If
Medicaid?
they have a Medicare or Medicaid card, then they
Right.
can come in and get their test kit for the household.
I think that sounds reasonable.
Okay, and do we want to say up to 400 or 400 test kits? 500?
We're trying to hold some in reserve for other potential.
Mm.
Well, I mean, I
for
think
town
that's up to you,
employees.
right?
It sounds like the school is set in regards to, I mean, they're getting
I
this
agree.
separate allotment to send home with faculty and students. So I don't know that we're going to have to immediately allocate more tests to the school, which is another big population we considered initially.
Yes. Well, we did allocate a big number of tests to them, right? Just to capture all the possible needs. The other thing that's good to know is that EEC, or early childhood education, is, as the state is stopping test and stay for elementary and middle and high school education, they're starting test and stay for daycare. So they're going to be providing test kits to daycares, which I personally am very excited about. But hopefully that'll prevent kids from, getting exposed and then being out of daycare for 8 days, which has been like torture. So that's another population that we considered was daycares as having access to test kits.
And we have a stash saved for town employees.
Yes,
Yes.
100 test kits, 50 so we can just review quickly what we distributed before, or what we plan on distributing before. Can you grab me that list? Yeah. Thank you. So we have 100 for Southampton Essential employees, 200 for Norris School with an additional 50 for Hampshire Regional High School and Smith Vocational School, Southampton residents, 50 for Southampton Meadows, 100 for Council on Aging, and 50 test kits for the food pantry. So that was our initial distribution plan.
Yeah, I think the target population is those who have limited access, which clearly is the Medicare, Medicaid. Starting with 400 is a great number, and if we find that they're flying off the shelf, we can, and we're not seeing other needs elsewhere, we can reassess and see if we want to allocate more.
I think that's a great idea. So we say 400 to start, in addition.
400 to start.
I just want to share something that I learned today. A couple of us went over to tour the South Hadley Senior Center because we got a donation for a senior center in Southampton. And I used to work with the director there. She said that you can actually, well, she did this. She had a flyer about something she wanted to get out to the people that get home delivered meals from, in their case, West Mass Elder Care. So if we ever wanted to do a flyer or something, we can bring it, I think, to the our ASAP, which is Highland Valley Elder Service, and they won't tell us who it is, but they will distribute with the lunch a flyer from our town. I don't know if you've ever done that, Jerry, or not, but it was just another way to get the word out to people that get home delivered meals.
Oh, that's great.
I think we just have to think really carefully about how we're going to spread the word, because we don't want to just, post that we're distributing these tests and then have hundreds of people showing up to the town hall after they've already been distributed. I just can imagine that would be quite the nightmare.
Yes.
So maybe we can talk offline about the best way to get the information out to the people who need it. And to be honest, I always really try to be cognizant about posting actively on our community forums to make sure people have access to information. Maybe this will be something that we we don't do that for.
You bet.
Just because I don't want to spark controversy. But I think that's a good starting point. Okay, so are there any other people that we're missing? So I was wondering if 50 test kits for the food pantry was sufficient. Not sure how many people access services there, but that might be another way to reach vulnerable people.
Well, we could start with 50 and then have the
hear from them about how that went.
Okay, one of the things, just to make you aware, I'm not certain, but I don't believe that everyone who goes to this food pantry is a Southampton resident.
Oh, okay.
You would have to double check that. I know that's the situation in East Hampton when they had their community covered. They don't have to be a resident of East Hampton. So I suspect it's the same with us.
Yeah, I would guess it's the same. Yeah.
That's interesting to think about. I appreciate you mentioning that. So we'll just have to talk to them, right? And say that these are really for Southampton residents. I mean, it does make it hard, right?
That's going to be hard. That's going to be tricky. Maybe we should just focus on the COA then. And, Joan could maybe, the word will travel once, once they're back.
Did they have a plan of how they were going to notify people at the food pantry about the availability of tests, though? Because, is it like they're going to have them out and people could just help themselves? Or were they going to say, like, do you need a COVID test kit? And then in which case, if they were asking about it, they could say, are you a Southampton resident? Unfortunately, based on the funding, these are reserved for Southampton residents at this time.
Or we could ask the pastor to, just put up a little flyer, and then Southampton residents could go and ask for the test kit.
Yeah, I think that's fine. Okay. Any other comment about test kit distribution? So then that would leave a total of 700. So it's 146 plus 300. So that would leave 446 test kits that would still be unallocated, not distributed. That's still quite a bit. I just wonder if, right now, especially when prevalence is still a little bit higher, if it makes sense. By the time we get these second round of test kits, it's probably going to be a couple weeks. If it is worth trying to figure out how to distribute them, because
you may want to distribute them after that February vacation, though, after everybody's been traveling and on airplanes and in Mexico and at Disney.
So we can leave that for the next meeting. 400 left. And maybe by then, once we get out the first round, we can get some feedback from people who receive them on how it's going.
And we'll see what the numbers are and what's happening too.
Definitely. Okay. Another thing that came up today was the federal government is distributing N95 masks to apparently select pharmacies across the country, so that way they can provide free either KN94 and KN95 masks to people where they just have a greeter at the door that essentially hands out masks. I found out from Becky at Walgreens that they found out just yesterday, that they are not going to be allocated masks, which is totally unfortunate.
Why?
Yes. So Becky is talking to her manager about that, but she said so far she knows that Westfield and Holyoke are receiving allocations. I don't know about East Hampton. But of course, there have already been people reaching out about if we are going to plan on offering masks for people, rightfully so, right? Just really challenging to make things fair in the world when, and I thought this was also going to be frustrating for towns that might not have a pharmacy, right? So I was thinking about West Hampton or other smaller communities, Hilltown communities that might not have a community CVS or Walgreens close by. And I read a little bit about community health, like small health center distribution, and it does not seem like the big plan at this point incorporates a lot of small community health centers. This is all very new information, so I was just trying to comb the internet and see what I could find out before this meeting. I honestly, I don't know how we could potentially distribute masks to people without without it taking, town purchasing the masks, distributing the masks, how that would work, how we would make it fair to people, where we would provide them to people. But I do think it's valid frustration for people who might not be able to access masks and might not have the money to purchase masks. So I think they would be able to go to Westfield or go to Holyoke if they're able to, but of course that's inconvenient for a lot of people.
Right.
Yeah, from what I read, it seemed like they were prioritizing more low-income communities as well as larger population centers. So based on those parameters, it makes sense that it would be Westfield and Holyoke and not necessarily Southampton. And prioritizing, I don't mean like, they mean they'll get them this week and we might get them next week? I don't know. And I don't know if anybody really knows that yet.
No. So I think we could, just say right now we don't have an answer because unless we're going to purchase an extremely large quantity of masks, which of course, if they're handing out up to three masks per person in a Walgreens, we'll hand out 3 masks per person. They'll be gone, and
they have to be taking them out of the packages, though, because they either come in a package of 5 or a package of 10. So now you have people handling the masks, which I don't think is a great idea either.
Yeah. I just,
Aren't they individually wrapped? The ones I buy, they're not.
No.
I don't think we know, right? I haven't seen these in stores, but I just know that not everybody's going to receive them. I also think about the staffing demands for these stores. To be able to distribute masks, you essentially have to have an extra person at the door just to hand out these masks, which
Right.
I don't know that that's feasible for all community stores.
Is CVS going to have them in East Hampton?
I don't know about East Hampton. I only heard about Walgreens in Westfield and Holyoke, but Becky was going to look into it and get back to me. But if I hear more information, I'm happy to share that with you. And I will also just respond to the person who reached out through a third party and say, we don't have a plan at this point. And unless we plan on purchasing, 20,000 masks right now, it doesn't seem feasible that we'll be able to distribute them to people, but we could encourage people to go to a neighboring town to.
Well, they also have a shelf life. So if you got 20,000 of them and then you didn't, distribute them, then after a while they're.
Yeah. I mean, 3 masks is only has so much reach, right? Okay.
Is there any budget available to provide some, maybe to the food pantry? Or could the food, like around the holidays, the food pantry asks for particular items, maybe they could be asking for masks so that they have masks to distribute to those that are very, very much in need?
We can find that out.
So we're kind of crowdsourcing it that way,
Yeah, that's a good idea because, it seems like they're more readily available to purchase for folks who have means. So if people wanted to donate them there, that would be
a good idea. Okay.
Well, people can also double up on the mask or, use one of the surgical masks and put a cloth mask over it too.
Yeah. I think it's an imperfect solution, right?
Right.
Just like everything else during this pandemic,
I
it's a
know.
partial solution, right? Okay, any other comments about masks or test kit distribution? There's more to come there.
Kate, I'm not on the board, so I'm not sure if I'm allowed to ask a question at this point, am I?
Go ahead.
At the very beginning of your opening tonight, you talked about forward, we would be doing surveillance and not capturing everything, but protecting the vulnerable. I would think eventually we would get to that point with the masking as well, where the mask mandates will start to fall, and then the focus of these higher quality masks can go to the most vulnerable. Does the town have any criteria it's trying to meet before it changes its mask date, or was there a mask mandate, or was there a criteria that we hit that caused us to put it in place? I don't understand how that works. I'd like to know more about that.
It's a great question. And actually, that's one of the things that we need to discuss. Two things, the Council on Aging as well as mask mandates. So the reason that the mask mandate was implemented was because of a sharp increase in the prevalence of COVID cases in town, and also some feedback from town citizens that they didn't feel safe going into local grocery stores or other town stores because people, including staff, were unmasked. We had previously done some research and communicated with both law officials, with the state about how to appropriately implement a mask mandate, meaning in the absence of an emergency order from the governor, it just makes it a little bit more tricky because the responsibility falls on the business owner to enforce mask requirements. We did not set up specific criteria in order to revoke that mask mandate because we said that we would continue to review it at upcoming meetings. And we didn't at that time know what to expect, right? We knew that Omicron was up and coming. We didn't know what case rates to expect, but we did know that there was a lot more cases. We didn't base it upon number of hospitalizations or anything because it's hard to track that in Southampton because we don't have any hospitals in Southampton. So data that is Southampton specific is really limited to the overall number of cases. And we knew that cases were also highly prevalent in our region and putting a significant strain on our hospital systems, right? So when you have your hospitals at capacity or over capacity, it makes it so healthcare provision becomes more challenging, even for people who don't have COVID, right? So I think that's something else we need to take into consideration before we make a decision to revoke the masking requirements, because hospitals, even though COVID rates just for this week have continued to have dropped, which we went from 204 cases to 36, which is pretty phenomenal. I think we need to give it a little bit more time to see I personally feel like we need to give it a little bit more time to see what pandemic conditions look like over the next several weeks, as we don't know if there's going to be another uptick. This is the first week we've actually had a decline in cases. And we also don't know what the impact of our mask requirements have been on overall number of cases in town, right? You would hope that by implementing a masking requirement that it would decrease the number of cases, right? So we think it's a good thing that the cases are lower. In terms of reviewing the masking requirements, I think it needs to be discussed at this meeting and then potentially next meeting just to see how things are going. I'm not sure if you ladies feel any differently about changing the masking requirements at this point, but of course, there's still new variants emerging, new information emerging, and that makes it really challenging to revoke the mask mandate, at least at this point. I hope I answered your question okay.
It wasn't, I was just interested in the general philosophy and where the board was headed. I was not,
no, it's good.
I don't want to take the attention off of the rest of your agenda. I was just curious. Thank you.
No, but I appreciate it.
I know Bay State is still in code red. Bay
I'm
State,
sorry?
Bay State is still in code red, which means that I think it would be premature to revoke the mask mandate, but I think it's great news that it's going in the right direction.
I agree. Bay State and Coley Dickinson Hospital are still extremely strained right now. The Bay State health system, I mean, I hear regular updates that their staffing is still less than where it needs to be. And they also have many people out. Kate, you know, you work there, right? So you see it every day, but you know, they've been having significant staffing challenges because of the number of staff who are still out with COVID too. So, and maybe we can put that on the agenda for the next meeting just to talk about that.
I spoke with a business owner who was wondering about the mask mandate when it was first instituted. And, when I told them that we'd had feedback that people were going to other towns to do their business, to do their shopping and to buy things because East Hampton had a mask mandate and people felt more comfortable there, they were, concerned and then relieved to hear that that would make sense and people would feel more comfortable coming back to their business again. So, I think also it's good for businesses to have people feel comfortable coming there. And it's obviously good for public health, which is our most important thing, not protection of businesses. But that was another component of it that this person hadn't realized. And when I brought that to their attention, they're like, oh my gosh, well, thank you. Like that makes so much sense. And we're appreciative.
Well, I hand delivered a copy of the mask mandate and signage for them, all the businesses to put up. And every one of them was very, very nice and very thankful that the board instituted the mandate. It made it much easier for them. Their employees felt safer.
Mm-hmm. Yes. And especially having masks worn in public buildings like schools and town hall. It does also protect the employees in those buildings too, right? It's not just about the people entering those buildings, but it's also the people who work there who are put into a vulnerable place, right?
Right.
Well, I think Americans are not used to wearing masks. Years ago, I lived in Japan, and if anyone had a cold or didn't feel well, especially if they were traveling on public transportation, they're very courteous. They would wear a mask.
Mm-hmm.
And I think maybe eventually, I don't know, it will be personal preference for Americans and they may be a little more courteous.
Mm-hmm. That's great. I really appreciate the discussion about that. Okay, so I'd like to move on to the discussion about the budget, which I understand needs to be approved
for submittal.
For it to be submitted like right now, right? It was due last week.
Right.
And I was just curious, Francine, Leah, and Kate, if you had an opportunity to review the budget attachment, and if you're able to see that.
Yes.
Okay, does anyone have any? You don't have it?
It was part of it. I didn't get a package.
Well, you should receive it.
Oh, I'm sorry. That's my error. I quickly sent this out to the board so that you could approve it, so then it could be sent to the town accountant, the select board, town administrator, and finance committee.
I have to sign off, so thank you, everybody. And I'll see you at the clinic, and Gary, I'll give you a call.
All right, have a good weekend, Rena.
Thank you. Yep, stay safe, everybody.
Yep. Okay, Francine, I forwarded that to you just so you can take a look at it. And
Okay.
I apologize that you were unable to do that before the meeting.
I mean, clearly this is a work in progress and it may change too when the board meets with the finance committee and,
And do you know when that meeting is?
I don't know until I give this to Ed.
Okay.
Yeah. I don't think they've set their schedule up. Do you know, Francine?
No, I haven't heard. I know they're meeting next week, I believe
Okay.
on Monday, I think.
All right, they may be taking a look
They may
at
be,
who
yeah.
submitted.
Yeah.
Okay. I did see that our operational expenses were pretty, there's a slight increase in mileage, professional dues, conference. It was hard to compare the the expense lines for this, but
It's these are the expenses that are broken out of that expense line.
got it.
I
Okay.
mean, this is pretty much what was submitted last year. I think it was around 11,000. I think there's only an increase of like $350 or something. Right, because it was 3,000 for operational expenses, and then sharps and mosquito, those special projects stayed the same.
Okay. Does anyone have any questions about the budget or any suggestions for changes prior to the meeting with finance with the full, understanding that any of these line items might be changed at that finance meeting?
There was nothing that stood out to me as having a question.
Okay.
And
Agreed.
you can always discuss it at your next meeting too, if you have a meeting before finance.
So last year, I attended the meeting with you with finance, and it just gives them an opportunity to ask questions, to offer input. I think last year there were some questions about the mosquito program and the sharps program. I was happy to answer those. But I think it's okay to move forward with a motion to approve the draft, and we'll see if there's any recommendations for changing after that meeting. Everyone feels like they had enough time to review it? Okay, I'd like to request a motion to approve the draft for budget for fiscal 2023. Hard to believe.
Oh, I know.
I'll second that, Savarese.
Okay, awesome. And we'll see what happens at the finance meeting. I'll be happy to bring back any discussion from that meeting. Okay,
Well, they can all go too. If they
oh
want
yes,
to.
please, if you'd like
Yes,
to
if you'd
attend,
to go.
more the merrier.
When is it scheduled for? When is
We don't
it?
know yet.
We don't know yet. Okay.
Okay,
It will probably be in the evening. My guess is around 7:00. That's when they meet.
okay. I just have one more update, and I think that so we're currently working on an ad hoc committee group to start the planning for the splash pad. And I just wanted to make note of this for the minutes. So I had reached out to Jerry, who was going to get in touch with a contact, but in the meantime, the director of sanitation for Massachusetts reached out to me to clarify some of the Massachusetts regulations for splash pads, because the existing CMR laws pertaining to swimming pools were very restrictive in terms of requirements, such as regular water testing. Some of them had attendance, showers available. There's a long list in the 435.000 sanitation requirements. And there had been really conflicting information coming from everybody, splash pad vendors, different towns, existing splash pads giving us feedback, or municipalities giving us information about what the regulations were. So I really wanted to hear it from the horse's mouth to make sure that we are incorporating what the actual requirements are into our planning, because that really is going to tell us how we're going to move forward. The gentleman that I spoke to was very helpful, and I sent everybody some notes from him. He stated that the existing laws that pertain to swimming pools, the 435.000, you can read it if you have a couple of minutes. Do not.
It'll put you to sleep.
It will put you to sleep, but they do not directly apply to splash pads, and instead what they're trying to do is promulgate a new set of regulations that incorporate splash pads and spray decks. So splash pads have recirculating water. Spray decks, which is what we're trying to install, do not have recirculating water, and therefore, unless they're standing water, don't necessarily pose the same health risks as devices that recirculate water. So the new red line, so they go through and they make recommendations for changes to regulations. They have created red line regulations. They sent them out for public comment, which have since been returned and are under review. And then they've sent out a second draft, which is largely not impacted by public comments relating to spray decks. So there's hundreds of public comments pertaining to everything else besides spray decks. So they actually think that the new regulations are going to go into effect that basically state that non-recirculating spray decks, so anything that doesn't have standing water, like a wading pool or recirculating systems, do not have to adhere to the same swimming pool guidance, which is actually a huge benefit because then it reduces the maintenance costs as well as the monitoring costs. But what he said was, and I think this is really important in our planning, is that just because something isn't regulated doesn't mean that it's not public health best practice. So it is the minimum of what you're allowed to do is what's written into the regulation, but what is practical and what's best for public health might exceed that. So as an example, not having bathrooms available at Conant Park, it's kind of a problem, right? So if you think about having facilities accessible to give people an alternative to the splash pad if they're going to have their kids running around, or a way to change their clothing if needed, is not necessarily advised. The other thing he brought up is that having a shower, although it's not required, is still a public health intervention, right? Even if they say at pools, for instance, nobody monitors the shower to make sure that everybody's showering, but if 75% of people take a shower, it's still better that the shower is there than if it's not there, right? And so he was very practical in stating that every intervention that we put into place, even though it might not be a regulatory requirement, will still help to keep the public safer. So I think we need to take that into consideration while we're planning. And I would love to hear from Jerry's contact. In addition to,
I was going to get in touch. I know Steve Hughes too. You just got to him a little before I did.
yeah.
So the water itself doesn't need to be treated in any way. It doesn't, because it's not like a pool, right? It doesn't need to be chlorinated but then just thinking of the other measures, like you said, I mean, obviously if there's little kids that are there for a long time and there's sound of running water constantly, I mean, they're going to need to use the bathroom. You don't want them to pee on the splash pad.
Yes.
Well, you're going to end up, I think, maybe dealing with another regulatory agency unless, what did he tell you about disposal of this water?
He said you need to talk to DEP.
There you go. So that's going to be another little.
Or not DEP. He said if it's not treated, then it's a little bit different, but he said that was not, he said that there's additional steps that needed to be taken there. And we didn't.
It's not going to be quite as fluid, I don't think.
Fluid.
And, no pun intended. But the original regulations certainly did not address splash pads and spray decks. And I think it's going to take a little while to finalize those new regulations.
Correct.
And they may go back out for public comment again. But in the meantime, did he explain to you that those are not in force right now? What's in force are those pool regulations.
He said that those do not apply to spray decks. That they're not enforced, that there's no directly applicable law that can be enforced as it relates to 435.000.
I think at that point, then what he's telling you is that there are no regulations.
That's what he said.
A spray deck.
That's correct.
But you can't discharge the water directly to the ground.
That's a whole separate project, but I just wanted to make note of the fact that.
But that's good to let them know because they've got these splash pads and spray decks at DCR facilities and, they're all over.
Yeah.
So it makes it easier for the regulatory agencies and boards of health if they do have something in place.
They said that most of the DCR facilities can operate as a spray deck or a splash pad. So they have the option of recirculating water, but the majority of them only operate as non-recirculating water because then they don't need to follow the same requirements. So it's cheaper for them to operate them on a consistent basis if they're not recirculating water. But if there's water restrictions that go into place, then they're able to kind of switch it up and continue splash pad using less water.
But larger communities also have sewer systems, so it's easier for them to dispose of water, especially after little kids have been in it.
So to be discussed later, basically.
Right.
Yes. Oh my goodness, so much research. Okay. I guess we need
Kind
to,
of fun.
it is fun and it's exciting. Okay, so we need to talk about our next meeting.
Are you guys in charge of the whole water park project or just the safety aspects of it?
We were asked about the safety of, so in order to move forward with the engineering, they really wanted to understand the regulations because it does impact potentially other projects within the park. So it's not just the splash pad project that might be impacted. It might be the bathrooms. It might be other things that need to be factored in. So I think the sooner we communicate that information to them, the better.
Got you. It
And
sounded like you're running the whole project. I was like, that is a massive undertaking.
Nope. No, thank you.
Okay, next.
If there's anyone that can do a massive undertaking, it's you, Kate.
Okay, we got the money. Now we just need to get everything else. So it's the 27th. I know we kind of held this meeting to try to get something on the books pretty soon because there's been so many changes. I'm hoping things will try to level out a little bit. I don't know if like the 21st, which is a Monday. Oh, that's President's Day. I don't know if that matters.
That's full vacation.
Oh, is that vacation week for you, Leah?
That is school vacation week, but I could do it that week. I'll be around.
Would it be better not? I mean, it's up to you. I don't want to cause any undue burden if you had plans, but we could always do it the week prior on like the 17th.
So the 17th is St. Patrick's Day.
Oh, never mind.
Which I don't.
February.
Oh, we're in February. Never mind.
Don't worry, I was going along with it.
Start early.
I think, I don't know if I want to go further out between the 17th and the 21st, because the last time we tried to do that, there was like 40 things that changed in between meetings, and we ended up having to have an emergency meeting, so.
So I'm working on the 21st 1 to 9, but I'm free on the 22nd.
Is that a select board meeting?
The Tuesday, 22nd.
I could do Tuesday, the 22nd.
Francine, is there a select board meeting?
I'm checking the calendar. We're booked through the 15th. No, well, on off weeks, we've been having executive session. So our meeting is the 15th, which means the next meeting would be March 1st, regular meeting. But those intervening meetings, the 22nd would be an executive committee meeting.
Aren't you lucky?
I know. We're pretty much every Tuesday.
Okay, so I would like to try, just because we missed you last meeting. So what about the 16th or 17th?
The 17th could work. I work till 4.
Okay.
And if the meeting's at 5, it's fine. On the
17th?
Or the 22nd.
Either one.
You want to do the 17th?
No, that works for me.
I can't do the 20. Well, I can do the 22nd from 5 to 6.
How about you, Leah? Would the 17th work for you?
Could we do the 17th via Zoom? Because on Thursday nights, my husband takes my older son to basketball. So my younger kids are in the background over there.
Why don't we try the 22nd then?
Okay.
That might be easier for
22nd.
everybody.
So you
Okay,
said
well, we'll just try to keep it to an hour so Francine doesn't miss out on her.
Yeah, if we do the 22nd, we can.
Okay.
And if you do it on Zoom and it's recorded, I can catch up.
Yeah. Okay.
Well, we can record it anyway.
It's being recorded now.
Right.
Yeah, it's being recorded. That's what I'm saying. I can
We
catch up.
recorded anyway for you, Francine.
Yes, it is. If you look up in the upper left-hand corner, you see the recorders running.
Yep, so why don't we try to do it would you prefer to do it on Zoom?
Sure.
Okay, let's do the 22nd on Zoom and I can come here if that's helpful for Cherry.
Hate Zoom.
Okay.
We just gotta make sure I get the login info in case Ed's not here. Okay.
Oh, he should be.
Well, I just wanted to say that I really appreciate all of your comments and your input, Kathy. It's been very helpful. Now, are you a student?
Couldn't hear him.
Yes.
I'm just a citizen in town and a parent.
Oh, you are? Awesome.
Yeah.
Okay, well, it's nice to meet you. I was just curious. You're so engaged and your comments were so valuable. I really appreciate your participation
Do you
in
have
the
a
meeting.
medical background?
I do not. I'm a Boy Scout for many, many years. And so we're used to really just digging into things and making things happen.
Got it. No, I really appreciate it. So thank you for that. And if nothing else, I'd like to request a motion to adjourn the meeting.
Motion to adjourn the meeting.
Second.
Okay. All right, so we'll adjourn the meeting at 6:17. Thank you so much for your time tonight. Bye,
Thanks,
everybody.
everyone.
Bye. Have a good weekend.
Thank you. Bye-bye.